Indeed. Welcome back to What She Said on Canada Talks with Christine Bentley, that's me, and Kate Wheeler in studio. And today we're going to talk to a scientific entrepreneur from Edmonton who is not only the co-founder of ColdFX, but the first and only woman CEO who listed her company on the TSX in life sciences and consumer health sectors. She has 2 doctorates in pharmacology and physiology. Her name is Dr. Jacqueline Shan, and her book is The Jacqueline Shan Story, Pursuing a Dream and Never Giving Up. So welcome, Jacqueline. How are you?
I'm good, thank you.
And thank you for getting up so early, because it's a wee bit early where you are.
Okay.
So starting from the beginning, back to your childhood in China, I found this very interesting. We both did. We're all mothers who've pushed our children to some degree, and your drive came entirely from you. You say your parents just didn't have the time.
Oh yeah, when I growing up and in China, it was a very unique time, and during the Cultural Revolution, and so most of the kids actually left, by their own devices. So I'm kind of a middle child of 3. I had a brother and a sister. So, and I'm by nature, I'm just very shy kid, and so, but I really curious about the books. I love to study, so I spent a lot of time by myself daydreaming and then study hard.
Well, you also say it's interesting that because of the politics of the Cultural Revolution, you never felt discriminated against for being a woman in science.
Yeah, that's when I growing up. Actually, one of the things that I do not feel I was different because I was I'm a girl. And so that's one of the things, and so it was good, I think, at that time. And the girls and the boys, and they treated pretty equally. So we were educated the same thing. Although we didn't have a lot of perspective about the life, I guess, and there wasn't any secondary education, secondary and like universities. So very little perspective. However, I think we all taught, and girls and boys are the same. We educate, and we got education. And when we grow up, we all have to work. And girls and boys are equal in a family as well.
Right. But when you came to Canada, did you notice a difference in that respect in terms of girls and boys and the expectations, and certainly when it comes to women in science?
Oh, in reality, I think we always, today's young people, and when I came to Canada and 20-something years ago, and I think the opportunity is really presented equally. That's the way I feel, to women and men, all girls and boys. But in reality, and when you go into university and then in the workplace, and you do see there's some differences, and in certain places, and you see more male, and in certain places you see more girls. So, but I do not see the policy, the politics, to that respect. I think and is pretty equal.
So you arrive in Edmonton with no coat and $5 in your pocket, and here you are today. I mean, how did that happen?
Well, at the time, and so if you really going back like 20-something years ago, when I first came to Canada at that time, then China was just about to start open up to outside world, and that was one of the reasons, and I was able to have that chance to come to University of Alberta to study and then to do research. And however, and when I growing up, and the material things, and we never had anything, or we had a very little, and it just kept a necessity of the life. So I didn't have money, but I never worried, and then I did have a coat, and but I lost it when I, during the transit, and from Vancouver to Edmonton, when I changed my flight, I actually. It's kind of a long story. I was late and rushing through the security gate, and then I lost my coat. I left there. So of course, and when I came to Edmonton, and it was the middle of winter, so that kind of presented a little bit challenge to me. And but also in a way my main purpose is come to study and research, and somehow I just didn't have the concept I need money.
Yeah.
So, but anyhow, so that was 20-something years ago. But in today's world, and I probably, and I would be scared, if I live in today's world without any money, going to a foreign country, which I have never been before.
This is Canada Talk Sirius XM 167 with What She Said, and we are talking to Dr. Jacqueline Shan from Edmonton. And Jacqueline, you were the founder, along with your mentor, of Cold FX, and then that was a mix between Eastern and Western medicine for you.
That's right. Yes. So really, and it was started why that come about, and then started back to my childhood dream. And when I growing up, and herbal medicine is kind of a part of health, and almost like a healthcare system that time. So when I was sick, and very often I was fed with herbal medicines, and whether it's in a very bitter tincture or like cooked and in the soup. So, but I always curious, and when I asked my grandma, my mom, and very often they couldn't tell me what's in there. She says, "Oh, this is just a secret formula we got from herbalist." So I always curious about how those medicine works. And then when I had a chance and went to university when I growing up, and I went to medical school and I chose pharmacology, trying to learn how drug works, and hopefully I will learn something about herbal medicine. So unfortunately, there was not much, science, and it's all lots of them based on the traditional and empirical evidence. So once I going through many years of graduate study and then learn how to do research. So I really like to apply in the modern medical research approach to find out how herbal medicine works, and hopefully I can develop something better, and which I can explain in the modern, medical way. So that was the opportunity when I came to Canada. I met this wonderful mentor, Dr. Peter Pan, and he actually have the same belief about the herbal medicine, also believing if we apply and science behind herbal medicine, actually we can make better medicine and safer and more effective. So that was the reason we believe in the value of a traditional medicine, but also we think we could improve in that by applying a Western medical research approach. So it is a combination of Eastern and Western medicine, and that was the first company and we created together, and eventually we developed Cold FX.
Dr. Shan, it's Kate Wheeler here. Now, lots of people think, they say, oh, it was an overnight success, but it was far from that for you setting up this company.
Yeah, that's absolutely correct. And so when people heard about the Cold FX, and we already, went probably more than 10 years of research already. So for, to discover and new molecules from natural sources, and we have to go through many years of research and in the laboratory, and after laboratory to proving works in the laboratory model, and that's not enough. And we also have to go on years of clinical research and actually test it in the human to ensure the product is safe and also effective. So by the time we launched the product and actually made a name of it, and people heard about it now, and it is available in a pharmacy store. At that time, we already gone through a decade of research.
And then you got Don Cherry.
Oh yes, that was a very fond memory of when I thought about it, and really, actually we heard about Don, and one of my sales guys, and was still remember, and during one of the hockey games, and he actually trying to explaining Cold FX to some of the hockey players. And then one of them says, you know what, and, grape, and grapes, we know that's Don Cherry's nickname. Oh, he loves it, and he's taking it. So that was, I heard about it. I say, look, and if Don Cherry and like Codefex is taking it, it must be helping him. So why don't we try to, persuade him and to see if he could be a spokesperson for Codefex. So that's actually, and eventually there's a long story, and so he's not that easy to get hold of, right? So, and eventually I had the first meeting with him in Toronto, still remember that. And so he was really surprised to hear, and the Codefex is actually coming from a little company spin-off from University of Alberta, and started created by me, an immigrant, a female, and come up, and come to Canada and had nothing. So he really liked the story. And then he's talking about how Codefex actually have been helping him. So we actually get along very well. So at the end of the meeting, so he agreed to be our Codefex spokesperson.
And he took on, Marketplace took you on. I actually watched that documentary. They said it was all anecdotal evidence and Health Canada hadn't approved anything. And he really, once he figured out what anecdotal meant, he really sort of schooled Marketplace and said, I don't care what the research said. This stuff works.
Yeah, so one of the things, of course, over the years, and Codefex has been staying as the number one selling cold and flu remedy in Canada, and being named the number one, and pharmacists and the doctors recommend it. So you hear many stories and from consumers, and the product helped them, which make me very proud. But in essence, because I am a scientist and I know and what is make a product work, so you need to go through the research and the clinical studies. So I guess that's what I have been focused, and the team of scientists and in our company has been focused. So, and then you take things as a totality, and when you putting all the totality of the evidence, and in my cases, and I focus on research. So I'm very proud of the fact that not only I'm proud of the fact that we did so many years of research and published so many papers, but also, the fact that you have many consumers and who believe and it benefits them and help them going through some of the tough times.
Absolutely. Dr. Shan, you're going to stay with us, and we're going to talk about your new company coming up after the break. This is What She Said, Canada Talks 167 on Sirius XM. We'll be right back.